sepsis is one of the most common cause of neonatal mortality. This can be easily prevented by a variety of low-cost measures. The common sense measures followed before entering the baby care area are: any person with any infection should not enter the baby care area. Before entering the area, remove the chappals or shoes. Enter the area adjoining the baby care area and remove the woolen garments, wristwatch and bangles if any. Wash hands with soap and water for 2 minutes, following 6 golden steps of hand washing. The hand washing should also be done for 20 seconds before and after touching the baby. Let the hand dry or dry with sterile paper. Discard the used paper in the black bucket. Wear sterile and labeled gown. Enter the baby care area. Note, the mother is approaching her own baby. Mother is changing the napkin and discarding the soaked nappy in yellow bucket. Babies catch infection from the environment, so it is important that all the necessary articles for the baby are kept separate. Baby bed, stethoscope, tape measure, thermometer, spirit and betadine containers are the few important ones. It is advisable to have ready list of these articles near the baby bed. Nurse should ensure that these articles are checked and kept sterile in each shift. These articles are used daily for the baby care, and therefore these should not only be kept neat and clean but also be disinfected. We will now observe how to keep the articles clean and disinfected. In this process, the first thing required is to prepare the baby bed. The bed of the baby should be prepared much before the baby arrives in the unit. For disinfecting the bed, take 2 ml of disinfectant and add to 98 ml of water to make 100 ml of solution. Dip the clean cloth in this solution. Clean the warmer with this cloth. It is important to clean each and every part of the bed, the side panels as well as the mattress. Let it dry for some time and then wipe with sterile cloth. One should use sterile linen for preparing the bed. Once the bed is ready, the next task is to disinfect other articles. The tape measure is to be cleaned with spirit swab. Stethoscope has also to be cleaned with the spirit swab. Clean the thermometer with spirit swab before and after the use. As you know, the thermometer should be cleaned from bulb to the other side. It is equally important to disinfect the container of the thermometer. The container is washed with soap and water and then put in the disinfectant for 1 day. Wash under the running water and dry it thoroughly before the use. The previous day betadine and spirit swabs along with the label are to be discarded. Clean the containers with soap and water every day and dry with sterile cloth. Put sterile cotton swabs in the container and then pour spirit and betadine in 2 separate containers. Label the container and put the date. Once all these things are ready, the baby is shifted to the bed. The warmer should be cleaned with soap solution and clean cloth every day when the baby is in the warmer. There are other gadgets which are required subject to the condition of the baby. These are weighing machine, laryngoscope, ambu bag, face mask, oxygen tubing, humidifier and hood. These articles should be disinfected and cleaned after the use. The display panel of weighing machine is cleaned with soap and water. Take disinfectant. To clean the baby tray, this should be done every day in the morning and after the use. Clean the laryngoscope with spirit swabs every day in the morning and after use. The blade should be cleaned thoroughly. If there are any secretions, then it has to be cleaned with soap and water. And remember, remove the bulb and put the laryngoscope in the disinfectant for 4 to 6 hours for sterilization. Face masks and ambu bags are dismantled and then cleaned with soap and water every day. The face mask should be put in the disinfectant for 15 to 20 minutes every day and ambu bag every 3rd week for 4 to 6 hours. Once these articles are removed, they should be rinsed thoroughly under the running water, dried with sterile linen and wrapped in a sterile cloth for the next use. Oxygen tubing and its humidifier are a good source of hospital-acquired infection. These should be cleaned every day. Wash with soap and water every day. Then put in the disinfectant for 4 to 6 hours. Take out the oxygen tubing and humidifier from the disinfectant and wash under the running water. Hang the tubing for drying. Once dried, pack in a sterile cloth for the next use. Clean oxygen hood with soap and water and dry with a sterile cloth. Wash katori and spoons used for feeding the baby with soap solution. and then boil for 20 minutes. The other important cause of hospital-acquired infection is intravenous injection. One should take all aseptic precautions while giving injections. Keep all articles ready before doing the procedure. Wash hands thoroughly with soap and water. Wear sterile gloves. Keep the sterile paper for further use. Clean the vial with spirit swab. Take out syringe and draw the desired drug without injecting air into the vial. Keep the syringe on the sterile paper and take to the baby. Keep the paper along with the syringe on the bed. Clean the stopper with spirit swab. Remove the stopper and keep on the same sterile paper. Slowly inject the drug. Remove the syringe and recap the cannula. Clean the stopper again with the spirit swab. After use, the needle has to be destroyed by the needle destroyer. The nozzle of the syringe is to be cut. Put both needle and syringe in the bleach solution. All healthcare professionals should know the disposal of waste generated in the hospital. As per the WHO standards, 3 buckets are used for disposal of different type of waste material. In the black bucket, waste paper, cardboard and leftover eatables are to be discarded. The materials contaminated with body secretions and blood are to be put in yellow bucket, and in the blue bucket, one can dispose of sharp objects like needles after destroying, a plastic product like syringes and feeding tubes after cutting. These wastes should then be disposed of properly. To keep environment clean, it is equally important to clean the wall and the floor of the area. With the disinfectant, clean the walls of the baby care area. Clean the floor in each nursing shift and as and when required with phenyl. After taking these precautions, we are sure that our babies are not going to catch infection. Another important and low-cost measure for preventing infection is promoting feeding mother's own milk. If we are able to enforce these practices and policies in our baby care area, we are sure that we are going to help the babies admitted with us. We'll be able to ensure their early discharge and reduce the cost of hospital stay.